Good afternoon, Hattiesburg. Thanks for joining us for this Wednesday afternoon briefing on COVID-19. Today we'll go over today's numbers. We'll look at a couple of sort of deeper dives into some data. We'll pass along some information from our State Health Officer, Dr. Thomas Dobbs, and of course our regular Act of Courage. Today's numbers, these are system-wide numbers for all four of our healthcare organizations, Hattiesburg Clinic, Forest General, Semri, and Mary Health Wesley. We did hit the 20,000 test mark this week. We're at 20,803 total. 1,903 of those have come back positive. 18,297 are negative. We currently have 602 tests which are pending. 40 patients right now in our two hospitals are positive for COVID-19. That's right in line with the last 14 days. In the ICU, these are our most acute patients. We have 14 people who are positive for COVID, one under investigation. While that's two higher than yesterday, it's still a couple under what we've been the last 2 weeks. This kind of shows what our hospitalizations have done over the last 2.5 months. Of course, we kind of hit that really big spike around between the 8th and 15th of June, where we almost got up to 50, but that number dropped. We're now leveling out at 40. ICU patients have continued to drop. We're still between 10 and 20. We hope that number stays there and gets even lower. Today, Forest County added 5 new positives to go to 742. Lamar County added 2. Since we had our last briefing on Monday, Forest County's added 13, Lamar County's added 14, brings our metro area total to 1097. We look at our 5-day positive average, where we take the number of new positive cases on a given day, we average it with the 2 days prior and the 2 days after. For the last few days, the 5-day average Lamar County has been a little bit higher than Forest County, which is a change from what's been going on since this began. However, we do, what we saw after Memorial Day, what we saw after Easter, what we saw after Mother's Day. About a week after that, we see a bit of a spike in the numbers. So you may see those numbers flip-flop again and go the other way. But either way, we're glad to see both of our counties under 10 new positive cases per day. The other thing we look at is the number of cases inside the past 14 days. Because this disease typically has a life cycle of 14 days or fewer, unless there's an adverse reaction. The number of cases, of new positive cases inside the past 14 days is kind of a good indicator on how many active cases you may have in your community. And Forest County is down to 107. Lamar County is at 93. And we look at this kind of over time. The last time that Forest County was at near 100, as few as 100 cases in terms of active inside the past 14 days, was the beginning of May. And so it's a very promising sign that Forest County's brought its number of new positives inside 14 days down to as low as it is. Again, we may see that number turn around with Father's Day and knowing people were kind of together then. Lamar County is at its highest point thus far, but typically they stay around the 50 mark, and we anticipate that will continue. Our goals going forward, we want to continue protecting vulnerable populations, which will help us with preventing overrun of the healthcare system, because those vulnerable populations, people over 60, people with underlying or chronic health conditions, typically are more prone to have adverse reactions to COVID. So 1 and 2 are very much tied together. And then, of course, prioritizing public health while our private sector is allowed to continue doing what it does. 4 factors: widespread availability of testing. It's kind of been a big part of where we've gone over the last month, especially with the addition of C.E. Roy Community Center in terms of its free testing capabilities. The wearing of masks, which we posted about on our Facebook page of the city yesterday. Also watching our own data, listening to all voices. And we want to take kind of a deeper dive into those last 2 today. We've shared this statistic periodically, maybe once a week, just kind of profiling who is in the ICU right now, what kind of folks in terms of age. Right now, there's 14 patients, as we said, that are in the ICU for COVID. The average age of those individuals are 62. We have some as young as 44, one as high as 85. But 62 is the average age. They come from 8 different counties, and I will tell you that the last time we spoke, Forest County had the highest number of those. That's not the case right now. Marion County is slightly above Forest and Lamar, and so, but 8 different counties make up those 14. There's not one county that just has an exorbitant amount of those. But kind of diving deeper, even further into the surrounding counties, we shared this last week. Kind of what's been the growth since about May 22nd. That was the point in which most everything was opened up. And so you've seen counties around us that have really seen some big increases. Now, Jones County is the one that we were concerned about for a while. They went from 422 on May 22nd to 965. Their growth rates actually slowed this past week, but still 128% increase over the last month. Their city council did pass a mask order last week. Wayne County, also a big increase from 72 to 446. That's a 519% increase in 1 month. Covington, a 98% increase, but not as many. Same thing in Marion County. About 100 increase, 97% over the last month. Greene County has a 914% increase. However, that's going from 7 to 71. So while that's a lot for potentially that hospital in Leaksville, it's not as many numerically, just a high percentage. And then, of course, George County, 19 to 58, which is about a 205% increase compared to all of those to Forest County, which is 60%, Lamar County, 65%. And I share this information for a couple reasons. One, to let you know that the things that you have done individually and the policies I think that we have all done and committed to collectively for the most part, I think those things make a difference. And we'll share some information from our state health officer in just a second on why we think that works. The second reason that we talk about this is that these surrounding counties, as we've mentioned before, once they overwhelm their community hospitals, they're coming to Hattiesburg for their health care, probably. Merit Health Wesley Forest General will take the overflow of this, and so that's why when we talk about our goals in terms of what we don't want to infect people that are vulnerable, because they will be the ones that end up in the hospitals that could potentially overwhelm the healthcare system. And so speaking of that, I want to share some information that Dr. Dobbs, Dr. Thomas Dobbs, our state health officer, gave a couple of different news outlets yesterday and today. And I must tell you that Dr. Dobbs is not an alarmist. I worked with him for several years when he was state epidemiologist, and I was on the public health committee. And so he's a very practical, rational person, but he gave some very stark warnings today. And this is kind of what he bases it on. As of yesterday, we had 523 people in the hospital in Mississippi, which is the highest number to date. Now, that's not the case in Hattiesburg right now. Again, I think a lot of the individual decisions that you've made have prevented that. We only have 40 between our two hospitals. We also had 611 new cases yesterday, and we didn't see that in Forest or Lamar counties, but it is happening. And then we had another 526 today, so 1,100 cases added over the last 2 days throughout the state. And so he kind of gave this warning today in an interview with the Sun Herald, that COVID is going to be a major stress on the healthcare system, and it could become a healthcare disaster going into the fall as temperatures get colder, as people start getting more prone to getting sick. And he kind of gave a few things that he suggested that people do is continue wearing masks in public, which is something that we have encouraged. Socially distance yourself and avoid large crowds. These are very rational things that he can do. And he mentioned this right here, is that COVID's not going anywhere. And the sad thing is, simple measures will buy us time until we get an effective vaccine. And we've issued that warning as well. COVID-19 is not going to go away right now. It is going to continue to be a threat, particularly for the vulnerable, the elderly, the people with underlying or chronic health conditions. And so the more that we can engage in all of us together, healthy behaviors, and just do our part to protect ourselves and those around us, the better we're going to be. And so again, wear masks in public, socially distance yourself, avoid large crowds. Those are things that we can do, and we can get through this. And so that's the message today, is just stay the course. We know this is going to be a challenge for us. We know that a vaccine is still several months off, if not into next year. And so the way we continue to navigate this thing together is we continue just doing the right things individually and collectively. And so continue to wear your mask, continue to be responsible in the decisions you make in terms of where to go and how close to be around people. That's the kind of behavior that's going to prevent the vulnerable from getting sick and from you getting it as well. Okay, finally, our act of courage today. Ward 5 Councilman Nick Brown is doing a free curbside for his ward on Saturday from 2 to 4 p.m. at Bernadette Park. He'll be giving away some free meals. So a lot of sponsors have come together to help him do that. And so we want to thank Councilman Nick Brown for always sort of leading from the front, being on the ground. And so if you're in Ward 5, go by 2 to 4 on Saturday and pick up your free curbside. And as we go into the rest of the day, remember to wash your hands, take care of yourself mentally and physically. Please wear a mask if you go out in public. It really does make a difference. Do only what is essential, and remember, you are safer at home. Have a good day.